Hi, I'm Dr. Eric Law. I'm a Troy native and returned home about 6 or 7 months ago to practice in family medicine and sports medicine here in Troy. I practice with Pam Trantham and Todd Pearlstein. My wife, Teresa, is also a nurse practitioner and she practices with me. We see primary care patients at Southern Health Associates and also see patients here at the hospital. Family medicine is fairly well known as seeing all kids and adults. Sports medicine, primary care sports medicine, is a little more of a new field. With primary care sports medicine, we take care of athletes and all their needs. So we do take care of some orthopedic problems, casting, splinting, fractures, sprains, and strains, but we also take care of primary care problems, which includes athletes who are dehydrated easily, who cramp easily, taking care of clearance, preseason clearance for things like heart issues, and then also just the in-season illnesses and trying to keep the athletes on the field and as healthy as possible. I've enjoyed seeing patients here at TroyRegional Medical Center. It's really been a good experience coming back here. We've really got an excellent nursing staff. The patients have been raving about it and have been really excited about their experiences at the hospital. It's been a very positive experience, and it's nice to be able to keep people at home when they're having illnesses and surgeries that don't require transfer to tertiary care centers, but can be taken care of at home by hometown people and in a caring environment. With family medicine, we take care of course, primary care problems, so hypertension, high blood pressure, diabetes, cholesterol, and general illnesses. I really enjoy that side of my practice. A lot of people tend to give that up and go more just to sports medicine, but diabetes and high blood pressure and cholesterol and chronic illnesses really still are a challenge, and it's good to be able to sit down with someone and educate them through a process and help teach them how to help maintain their health and maximize their health themselves, as well as helping manage their medications and doing everything from our side that we can to make it as easy as possible for them. With spring approaching and spring football coming up, one of the real important things that we see an awful lot, fortunately, is cramping and dehydration. And so a couple of pointers when it comes to that is, one, always try to be very well hydrated going into a practice. If you are dehydrated or underhydrated coming into a practice, you'll never be able to catch up. You can sweat more than you can drink, so carrying a bottle of water or Gatorade or Powerade with you throughout the day coming into a practice is very important, so that you know you're as prepared as you possibly can be. In addition to that, you want to make sure you're getting plenty of electrolytes, which are salts, and sometimes that means putting a little extra salt on your food, and sometimes that means formal salt supplements and electrolyte supplements such as you could buy over the counter at a health supply store or a pharmacy. Finally, you want to make sure that you are well conditioned coming into the season. So the athlete needs to be out working or acclimatizing is the term we use in the heat, preparing for the drills they will be going through. These days we don't ease into practices anymore. They're expected to come into practice prepared and fit for the season. So you want to make sure that part of that is that they're ready to handle the heat, and they do that by getting out in the heat and getting exposed to it for the weeks coming into the season. As well as with younger athletes, we also work with older athletes and your weekend warriors, as well as those who take their athletics and their exercise more seriously. Exercise is very important for people of all ages, and even when you talk about primary care conditions such as diabetes, hypertension, and cholesterol, you get major benefits and major effects from exercise. It's really sort of a wonder drug of sorts. It increases your insulin sensitivity, so it lowers your blood sugars. It also lowers your LDL and raises your good cholesterol, your HDL, really better than just about any drug that we can give you. Of course, for the exercise that you do and any pounds that you're able to lose through it, you also lower your blood pressure so that you're in a more optimal range. So not only are you feeling better, sleeping better, and hopefully at a better, more healthy weight, as well as benefiting from the cardiovascular effects, but you're also benefiting by not having to take as many medications and from being in a more optimal health for later in life to prevent late life problems. For women, exercise is especially important as well because it helps to build bone mineral density, and weight-bearing exercises are very important. Of course, women are at a higher risk for osteoporosis and bone problems that lead to hip fractures and vertebral fractures. So exercise that increases your bone mineral density certainly decreases your late life risk for osteoporosis. We're accepting new patients at Southern Health Associates and certainly would love to take care of you and your athlete. If you have any questions or would like to fill out new patient information, you can call 566-9800 and talk to the nice ladies up front at Southern Health Associates.